Assalamualaikum warahmatullahi wabarakatuh. My name is Akmal Zaki and today I want to talk about how to how to stay fit and healthy during coronavirus pandemic. There is a direct relationship between your diet, physical activity and health. Your nutrition is a key player when it comes to physical, mental and social well-being, and it's important for preventing disease. Lifestyle factors might also determine if you are going to get sick or remain healthy. One of those factors is physical activity or PA. A sedentary lifestyle is usually associated with an increased risk for chronic disease, loss of movement, and decreased immune health. For those reasons, physical activity and movement are extremely important during the coronavirus pandemic. With that in mind, I will cover the benefits of PA, where your focus should be, how to think about exercise, equipment, how much you should be doing, and much more. Okay, next, who is at risk of getting infected by the virus? The first is older adults age 65 or older, those with chronic disease like diabetes, heart disease, and lung disease. And then the third, those with compromised immune system. Benefits of physically active physical activity or PA. Physically activity individuals usually live longer than those who are inactive or may have a risk of heart disease. Inactivity is an important risk factor similar to high blood pressure, smoking, or high cholesterol. These are some benefits of exercise. Stress and anxiety relief. Stress and anxiety are rising with the current pandemic, and it can lower your immune response. Exercising releases chemicals in your brain, such as serotonin and endorphins, which can help improve your mood, reduce the risk of depression and cognitive decline, and delay onset of dementia. Next is immune support. Regular PA or physical activities helps your immune system function. And the next is weight management. It shouldn't come as a surprise that regular PA paired with a balanced, nutritious diet helps with weight management. Excess weight is associated with higher health risks. Next is reduces health risks and prevent diseases. Regular PA reduces blood pressure as well as risk of serious health issues such as type 2 diabetes, heart disease, and stroke when it's paired a balanced, nutritious diet. Bone, muscles, balance, and flexibility. The next is bone, muscles, balance, and flexibility. PA also improves bone and muscle strength and increases balance and flexibility. This is important for everyone, especially older adults, because it can prevent falls and injuries. As for children, it aids with growth and development and sets healthy habits for the future. For children, PA can lessen behavioral issues such as ADHD and help with concentration during schoolwork, which is important now that they are at home all the time. Okay, steps to start being physically active at home. Focus on weaknesses. As a general rule, you always want to have an intention before starting a workout routine or program. That pinpoints what you're not good at and therefore what you are trying to improve. I summarize a few abilities I think people at home, both young and older population, should focus on. Go through them and analyze which ones you excel at, which ones you are moderate at, and which ones you like the most. I would start working on the latter and progressively move towards the rest This doesn't mean when you are working on one, you're completely ignoring the rest, but rather is a tool to have a specific intent with your PA. Okay, number one is strength and core strength. This is the amount of force a muscle can produce against some form of resistance. This resistance can come from external objects or your body weights. Your core is a set of muscles that play a key role in many movement patterns. Improving core strength may improve motion. Okay. Next is aerobic capacity and endurance. This is the ability of your heart and lungs to get oxygen to your muscles for their use. Okay, next, flexibility, mobility, and stability. Flexibility is the capacity of moving through your full active and passive range of motion. Mobility is moving your joints and muscles properly in an active manner through the range of motion, or ROM. Stability is maintaining control of her position and movements of your joints. People usually lack mobility and stability in their joints and lose overall movement. Okay, next is balance and coordination. Balance is the ability to stay in control of your body's movement, and coordination is being able to move two or more body parts with control. And then next point is split your body. There are different ways to think about a program or workout. I will give you 3 easy ways that don't require you to be an expert on the subject. Focus on each for any given workout and try to balance them throughout the week. The first is lower body, waist down, glutes, thighs, calves, and feet. Number 2 is upper body, waist up, core, back muscles, shoulders, and pecs. And then full body, the whole thing. This is trying to actively use your whole body to perform the movements. Okay, the next point is equipment. Some equipment is necessary to improve some of these exercise capacities, but you can get creative with it. You're just trying to create some type of resistance. I will give you a couple of options to start with. The first is body weight. You are able to create resistance with your own body weight. Squats, lunges, planks, and push-ups are a great way to build strength. And number 2 is equipment. External loads are also a great way to increase intensity and resistance. You can perform the same movements, but they will be a little bit harder depending on how much weight you add, which can improve your adaptations. Ways to add load to your workout from home are water jugs, detergent bottles, a bag full of books, and grocery bags full of stuff. Before you start adding weight, make sure your movement patterns and your breathing are on point. Remember technique before load. Then no shoes. A lot of your movement pattern are related to how you control the structure of your body with your feet. Shoes tend to give us different soles and elevation that may bring issues at some point. Try most of your training, even barbell lifts with no shoes, and actively push down with your feet while pressing out the floor with your toes. Your ankles, knees, and hips might thank you for it. Okay, next point is be the scientist of your own body. Be aware and constantly check your body, how well your body is adapting to PA changes from person to person. Keeping an eye on your weight, brain function, energy levels, and even your stool will serve as a guide. And then the next point and the last point, set daily and weekly goals. You can improve what you don't measure. Setting daily and weekly goals will keep you on on track and aware of your improvement. Don't set yourself up for failure though. Make sure your goals are smart. SMART. S stands for specific. 10 minutes of PA a day or 30 reps of an exercise a day. The specific uh, goals of the specific goals for your exercise. And M stands for measurable. For example, using the stopwatch in your phone to measure 10 or counting each rep. A stands for achievable. For example, you start small. If you have been sedentary for a while, start with 5 a day, then move to 10 and so on. R stands for relevant. Exercise have to be meaningful and relevant to your life. I think preventing being affected by coronavirus is pretty relevant. T stands for time. You need a time frame for each goal. Daily and weekly goals give you a time frame. You need to complete some amount of reps in a day and some amount in a week. Okay, I think that's all from me. Wassalamualaikum warahmatullahi wabarakatuh.